Hi everyone, my name is Kelly. I am an ACRN with the Penn State Market. I have been working with them since we launched back in June of 2022, so I've been an ACRN for about a year and a half now. A typical day for me begins with morning rounds. Our morning rounds tend to be our lengthiest and our most involved visit. I'll start with a head to toe assessment. I'll get their vital signs, record heart and lung sounds via echo stethoscope. At that point, we typically round with the doctor. Afterwards, I'll complete any new orders, I'll give all medications that are due, and I'll wrap up the visit with blood work. In between our morning visit and our afternoon or evening visit, typically tends to be a several hour gap. That gap will be filled with either an HRC Plus round, which is our new SNP at Home program, or any admissions. We'll also use that time for charting from the morning and following up with blood work with the doctor to see if there's any changes that need made at that PM visit. When I go out for the PM visit, I will once again repeat a head-to-toe assessment, repeat vitals, give all medications that are due, complete any new orders, and then we will set out medications that might need to be given later that evening for our virtual visit. And then overall just set the patient up for a successful evening and night. A challenge that I face as an ACRN are just the frequent changes to our schedule on a daily basis. Some of our patients require EMS transport home, and of course EMS gets very busy with emergency calls and meeting their own patient needs. So coordinating that on top of what our patients need can be a bit of a challenge. I am thankful though that I have a manager who really helps with that, who helps assist us and helps coordinate those issues that may arise to help us be as successful as we can overcoming those obstacles. One thing I love about being an ACRN is the individualized care that I'm able to provide. In a traditional bedside setting, you have multiple patients and you're often being pulled in several directions. But when I'm there for either like a morning visit or an evening visit, it's just the patient and I that I get to focus on. So you get to know your patients in a deeper level and you're able to assess things that you may not be able to in the hospital setting, such as how are they moving around their home? Are they able to complete their ADLs appropriately? Any social needs or food insecurities? Those are stuff that can be hard to identify in a hospital setting, but this is the perfect setting. We're in their home, we're in their environment, and we can not only identify it, but we can help set them up, whether that be with our patient care navigator or our therapy services to help the patient be as successful in the home as possible. Overall, I love working as an ACRN. I love working for a medicist, and I look forward to being able to continue to provide this high level of care. Thank you.